Next little chapter has to do with bites and stings. And let me go to vignette number 21. A 6-year-old child tries to pet a domestic dog while the dog is eating, and the child's hand is bitten by the dog. You know that in dog bites, in addition to cleaning the wound and tetanus prophylaxis and so on, the issue of rabies is raised. If it is a domestic pet like this one, if the bite is considered provoked, something was done that the dog didn't like, then we do not automatically begin with a rabies prophylaxis. In this case, the animal is put under observation by a veterinarian. If the animal shows signs suggestive of rabies, then the child is given the immunization. If not, you don't have to do it. Please note that we're taking that approach here because this is a bite to the hand of the child. If this identical vignette had said the child was bitten in the face, you would start the rabies treatment and then later discontinue it if the animal didn't show signs of rabies. Because remember, the rabies virus travels through the nerves on its way to the brain. Once it gets to the brain, you're dead. And so for a bite that is close to the brain, we got to treat right away. Move to vignette number 22. During a hunting trip, a young man is beaten on the leg by a coyote. The animal is captured and brought to the authorities alive. You might say, oh, we can do the same thing now. Put the coyote under observation by a veterinarian, see if he's behaving in a rather wild fashion. Now, wait a minute, how is a wild animal going to behave? I mean, there is no way that a veterinarian looking at a coyote will say that coyote has rabies or not. Yet, we have a good thing to do here because we have the animal. We can kill the animal, examine the brain. If there are signs of rabies, immunize the patient. If not, skip it. And again, we're given the time to do that by the fact that this bite was in the leg, not in the face. Vignette number 23, while exploring caves in the Texas Hill Country, a young man is bitten by bats that promptly fly away. Now we don't have an animal that we can examine. Obviously, this patient needs a rabies prophylaxis, which includes both the immunoglobulin plus the vaccine. We now go to snake bites. Vignette 24. During a hunting trip, a hunter is bitten in the leg by a snake. His companion, who is an expert outdoorsman, reports that the snake had elliptical eyes, pits behind the nostrils, big fangs, and rattlers in the tail. The patient arrives at the hospital 1 hour after the bite took place. Physical examination shows 2 fang marks about 2 cm apart, and there is no local pain, swelling, or discoloration. Now, the description given here is indeed a description of a venomous snake. This is a very good description of a rattlesnake. And you know the patient was bitten because you can see the fang marks. However, you should not make the assumption that the patient was envenomated. A patient can be bitten by a venomous snake and not be envenomated, in which case you do not need to do the treatment with antivenom. And that, in fact, is the case here, because the most reliable finding when you examine one of these patients is that very soon after the bite, if there was envenomation, within a half an hour, there is going to be exquisite pain and terrible tenderness and swelling and discoloration at the bite site, none of which this patient has. This patient needs tetanus prophylaxis, cleaning of the wound, observation for several hours to make sure he's not going to develop perhaps the signs at a later time, but probably he was not envenomated. On vignette number 25, though, we see a different situation. During a hunting trip, a hunter is bitten in the leg by a snake. His companion, who's an expert outdoorsman, reports that the snake had elliptical eyes, pits behind the nostrils, big fangs, rattlers in the tail. The patient arrives at the hospital 1 hour after the bite took place. Physical examination shows 2 fang marks about 2 cm apart, as well as local edema and ecchymotic discoloration. The area is very painful and tender to palpation. This patient was envenomated. We should draw blood for typing and cross-match, because if we need it later, we will not be able to do it. That is, the test will not be possible to do. And we also do coagulation studies and renal and liver function studies. The aggregate of these, the extent to which these are deranged, gives you an idea of how badly he was envenomated. And the mainstay of the therapy is anti-venom, specific for the specific type of snake, and we need to give several vials. At least 5 for a mild minimal envenomation, 10 for a more extensive one, perhaps 20 for a very severe one. Most of the other steps that at one time were used are not used. Most patients do not need excision of the bite site or fasciotomy. That will be very rarely required. Now, vignette number 26 gives us another view at snake bites here. While playing in the backyard of her South Texas home, a 6-year-old girl is bitten by a rattlesnake. At the time of hospital admission, she has severe signs of envenomation. Now, your tendency, if you don't know the answer to this, would be to say, well, if the big adult needed 5 or 10 or perhaps up to 20 vials of antivenom, this little girl will need 1 or 3 or maybe 5. No, wrong. Antivenom is one of the few medicines that are not dosed according to the size of the patient, but according to the size of the envenomation. And because you are told that she has severe signs of envenomation, she'll need the 20 vials of antivenom. Now we abandon the snakes and we go to bees. During a picnic outing, a young girl inadvertently bumps into a beehive and is stung repeatedly by angry bees. She is seen 20 minutes later and found to be wheezing, hypotensive, and madly scratching an urticarial rash. Let me point out there are many more people killed in the U.S. every year by bee stings than by snake bites. And they die in anaphylactic shock. And the treatment is epinephrine. That's the drug of choice. We also have to remove the stingers. Now we move to 2 other types of bites. While rummaging around her attic, a lady is bitten by a spider that she describes as black with a red hourglass mark in her belly. The patient has nausea and vomiting and severe generalized muscle cramps. This is a black widow spider bite. That's a description of a black widow. They characteristically have severe muscle cramps. The antidote is IV calcium gluconate, and muscle relaxants can also help. Vignette number 29 depicts another common bite. A patient seeks help for a very painful ulceration that he discovered in his forearm on arising this morning. Yesterday he spent several hours cleaning up the attic, and he thinks he may have been, quote, bitten by a bug. The ulcer is 1 cm in diameter with a necrotic center and a surrounding halo of erythema. This is a classical description of a brown recluse spider bite. You barely notice it at the time. That's why this man wasn't even aware when it happened. You think, oh, maybe he was bitten by a bug. The next morning there is that piece of dead skin. And the management, we have to resect that dead skin and eventually put a skin graft, but we don't rush and do it right away because the damage may not be fully obvious on the first day. It may not become fully obvious until later. So we start the excision, but we hold on the grafting until we make sure for several days that we don't need to excise anything more. And let's end the trauma review with a classic. A 22-year-old gang leader comes to the ER with a small 1 cm deep, sharp cut over the knuckle of the right middle finger. He says he cut himself with a screwdriver while fixing his car. That's not what happened. In fact, this is a classical description. This is in fact a human bite. And the way it happened is this nasty guy hit somebody in the mouth with his fist like this. The teeth of the victim cut him on the knuckle. He now comes in for help. He's not going to say that he hit somebody and he's bleeding to death in the alley. He doesn't want to confess to his crime. So he comes up with a cover story, fixing the car, the screwdriver. But anytime we see that sharp little cut right here, and he's not a nice person, but it's a nasty guy like the one we're talking about, we know that's a human bite. And that is important because a human bite is bacteriologically the dirtiest type of bite that there is. This patient needs to be taken to the operating room for very extensive debridement and cleaning because this is a serious injury. And that brings us to the end of the trauma review.